Health and social care integration is a once-in-a-generation opportunity to transform public services in Scotland to meet the needs of individuals the length and breadth of our country. And what's vital is that that process is taken forward with clear and distinctive leadership. And I'm delighted that public sector leaders here from all disciplines recognising the fact that we need all the strength and all the talent of public servants to drive this process and to improve outcomes for individuals in our society.
In the midst of the 180 people at the conference today are the 32 most important public service in Scotland. And this is the men and women who are going to be the chief officers of the new health and social care integration partnerships. And they're a very talented bunch. They've got a lot of experience in Scotland more broadly in all kinds of activities. And they've made immense progress to get us to this point in the way that they have. I think the big trick, however, is for us to recognise the leadership challenges that are ahead. Because however good you are in this business, actually you can always learn from others. So helping leaders to have that conversation in places of trust and to admit that some things are hard, some things have not gone well, can be a really powerful accelerator of progress toward a person-centred system. That's what we're all driving toward. Leadership is a crucial part of this, because if these complex systems could solve all their own problems, they would have done a long time ago. So bringing all this to life, making it work day by day, week by week for every man and woman who needs those services in Scotland isn't an easy task. Recognising that and working together to solve it is the challenge and the joy of leadership.
I think the value of today is to get the strength and depth of leadership across the whole of Scotland. We are used to talking to one another as chief officers, or we're used to talking to certain people within our organisations and around our organisations. But what you've got here are people from chief officers to the chairs, to chief executives of right across Scotland. So if people here aren't getting the message and we're not sharing information here, then this is just a fantastic opportunity for us to be able to share and learn from one another. And we're getting some key messages here about what the intent behind the legislation. This is about making a significant change in how we work as a public sector. So to feel that we are all making a contribution to that and hearing it from the most senior civil servants and the senior people across Scotland in terms of public sector is hugely important.
The legislation for integration actually talks about commercial and non-commercial providers. And in this context, the independent sector is probably the commercial end of this. So these are organisations who do ultimately have shareholders, derive profit. But some of them are very small businesses, so corner shop providers of care services rather than big business providers of care services. But within our care homes for older people, about 75% of the care homes are run by independent providers, and in care at home, over 30%. So there are actually more social care workers employed by the independent sector than there are by the public sector or the voluntary sector. So the independent sector is pretty crucial to the delivery of care, particularly for older people, but for some other groups of clients as well. And we would therefore be clear that actually round the integration table, if you don't have the independent sector there, you would be missing a trick, because you want all those providers to be signed up to the same partnerships agendas as everybody else.
Well, I think I describe this as being a revolution, replacing an old order with a new revolutionary order. And I think that's exactly what we're looking to do. We're looking to empower individuals and people within communities to shape the services they're going to receive, they're going to participate in. And I think that's fundamental to the success of health and social care integration. We want to be involved in early intervention, in preventative spending. We want to reach the hard-to-reach people who desperately need our assistance to live better, more equal lives. And that's what this investment in health and care integration will hopefully deliver.
Lots of people in this room today are really busy when they're at their desks at the moment. There's lots of technical tasks to be done in the run-up to integration, and I know that if these people are anything like me, they don't get as much time as they would like to just step back from that day job and to think a little bit about the more strategic ambitions and what the overall leadership ask is, and also to spend some time talking to other people who are doing the same job. So for me, the real value of today is that we've given some special protected space to people to get away from their desks, to hear about what other people are doing and hopefully to learn some lessons, to meet other people, but also to hear from ministers and from the causeless spokesperson about what it is that this is all meant to add up to. Because again, it's very easy to get down in the weeds and to be working out some of the practicalities and possibly to lose sight of the fact that there's a really big objective in all of this, which is about a move to much more person-centred integrated care. For me, one of the most exciting things about this morning has been the way that the team have brought other people's voices into the room. The films that we saw were just incredibly powerful examples of why it is that this matters. The fact that we saw elderly women in a care home able to make decisions about the type of person who was going to care for them. The fact that a guy from Craigmillar who was getting cared for 24/7 is now needing, I think, 27 hours a week and is talking about setting up his own business. And I don't know about the other people in this room, but if they're anything like me, then I think that will be a really powerful reminder of why some of that tough stuff and the governance and so on is all worth it. Because ultimately we could, in the way that the Deputy First Minister said, really change the face of care in Scotland to make it far more person-centred and really transformational.